Hi everyone, this is the first section of my leg and foot lecture. In this section, I will talk about the bones of the leg and foot, and also I will talk about the joints of the leg and foot. The bones of the foot, already I mentioned that the tibia and the fibula are the bones of the foot. Tibia is the medial bone of the leg. Tibia and fibula are the bones of the leg. The medial bone of the leg is the tibia, and it carries our body weight from the femur to the tarsal bones inferiorly. And tibia, I already mentioned about the proximal end of the tibia. The shaft of the tibia has three borders. There is anterior border, medial border, and interosseous border. The anterior border and the medial surface of the tibia is subcutaneous, and anterior border and medial surface of the tibia is also called shin, and tibia also it is called shin bone. Distally, at the distal end of the tibia, this bony prominence is called the medial malleolus. It forms the medial malleolus, and the medial malleolus and the inferior surface of the distal end of the tibia articulates with the talus, which is one of the tarsal bone, and that forms the ankle joint. The fibula is the lateral bone of the leg. It has the head, neck, shaft, and the distal end. The distal end of the fibula, it forms another bony prominence, which is the lateral malleolus. Lateral malleolus is more prominent than the medial malleolus, and also lateral malleolus extends more inferiorly than the medial malleolus. And see the lateral malleolus, the inferior articular surface of the tibia, and the medial malleolus together, they form a socket which articulates with the trochlear surface of the talus and forms the ankle joint. The tibia and fibula, they are connected with each other, and they form joints in three different places. Superiorly, the lateral condyle of the tibia articulates with the head of the fibula and forms the superior tibiofibular joint, which is a plain type of synovial joint. And inferiorly, the inferior tibiofibular joint is a fibrous joint, or we called it syndesmosis. There are ligaments which connect the distal end of the tibia and the fibula. And the sharp interosseous border of the tibia and fibula, they are connected by interosseous membrane. Like the interosseous membrane in the forearm, in between the radius and ulna, this interosseous membrane, which lies in between the tibia and fibula, it is a strong membrane. Its fibers are going inferiorly and medially, and the interosseous membrane has some openings superiorly and inferiorly. Through these openings, superior and inferior to the interosseous membrane, there are blood vessels which are entering from the posterior compartment to the anterior compartment of the leg. The tibia and fibula articulates with the superior articular surface of the talus. Talus is one of the tarsal bone. The bones of the foot includes the 7 tarsal bones, 5 metatarsal bones, and 14 phalanges. The 7 tarsal bones include the talus, which has a superior articular surface, which is called the trochlea. Talus has a head and neck, and talus is the only tarsal bone which articulates with the tibia and fibula and forms the ankle joint. The calcaneus is the largest tarsal bone. Talus, calcaneus, cuboid, navicular, and there are 3 cuneiforms, the medial, intermediate, and lateral cuneiforms. These are the 7 tarsal bones. And among these 7 tarsal bones, the calcaneus is the largest one. And calcaneus is the heel bone. It transmits our body weight from the talus to the ground. Calcaneus articulates with the cuboid anteriorly, and also calcaneus articulates with the talus and form the talocalcaneal joint. The talus articulates anteriorly with the navicular bone, which is a boat-shaped bone, and navicular bone articulates anteriorly with the three cuneiforms, the medial, intermediate, and the lateral cuneiform bones. And the cuboid bone is a cubical-shaped bone. It articulates posteriorly with the calcaneus and anteriorly with the fourth and fifth metatarsal bone. There are 5 metatarsal bones. The first one is shorter, stronger, and stouter one. And the second metatarsal bone is the longest one. And the fifth metatarsal bone, you can see it has a tuberosity at its base. The tuberosity of the fifth metatarsal bone gives attachment to one of the fibularis muscle, fibularis brevis muscle attached to the tuberosity of the fifth metatarsal bone. There are 14 phalanges. The great toe has 2 phalanges and the other toes has 3 phalanges in each. The great toe of the foot is also called hallux, and the muscles attached to the great toe bones are called hallucis. You will see that there are hallucis longus and hallucis brevis muscle. The ankle joint is a hinge type of synovial joint. Ankle joint, it lies in between the lateral and medial malleolus, which articulates with the trochlear surface of the talus. Ankle joint is covered by a thin and loose joint capsule, and joint capsule is reinforced by the lateral ligament and the medial ligament. Medially, there is a medial ligament. The lateral ligament of the ankle joint is weaker than the medial ligament. And lateral ligament of the ankle joint, it connects the lateral malleolus with the talus and the calcaneus. And lateral ligament has 3 different parts: the anterior talofibular ligament, calcaneofibular ligament, and the posterior talofibular ligament. These are the 3 different parts of the lateral ligament. The medial ligament connects the medial malleolus of the tibia with the calcaneus, talus, and navicular bone. The medial ligament is stronger than the lateral ligament of the ankle joint. Medial ligament is triangular in shape, and this ligament is delta shaped. That's why it is also called deltoid ligament. The deltoid ligament or the medial ligament of the ankle joint has 4 different parts. It has the anterior and posterior tibio-talar part. It has the tibio-navicular part, which extends between the tibia and the navicular bone, and the tibio-calcaneal part. Tibio-calcaneal part connects the tibia medial malleolus with the calcaneus. Ankle joint is a uniaxial hinge type of synovial joint. It produces 2 movements, the dorsiflexion and plantar flexion. So this is the dorsum of the foot. The superior surface of the foot is the dorsum of the foot, and inferior surface is the plantar surface or the sole of the foot. So the flexion of the dorsum or raising of the dorsum of the foot is called dorsiflexion. And the plantar flexion means when we stand on our toes, this is the plantar flexion of the foot, plantar flexion of the ankle joint. So dorsiflexion of the ankle joint is produced by the muscles of the anterior compartment of the leg. And the plantar flexion is produced by the muscles of the posterior compartment of the leg. I will talk about the anterior compartment and posterior compartment leg muscles in my second section of this lecture. The ankle joint is most frequently injured joint of our body. Ankle sprain is very common, and usually the lateral ligament sprain is most frequently occur, because lateral ligament, I mentioned that this is weaker than the medial ligament. Medial ligament is much stronger. And the ankle sprains are very common, or lateral ligament sprain is very common in athletes who play basketball, in which the jumping and running is necessary. The pot fracture is the dislocation of the ankle joint. Dislocation of the ankle joint is always, it's a kind of, the dislocation is always occur. It's a kind of eversion injury. I will talk about the eversion movement in a second. There are joints in between the bones of the foot. In between the tarsal bones, there is talocalcaneal joint, which is also called subtalar joint. This joint is in between the talus and the calcaneus. And also there is talonavicular joint. And together, these three joints, this is called talocalcaneo-navicular joint. And also there are transverse tarsal joint. Transverse tarsal joint is the talonavicular and calcaneo-cuboid joint. And there are some tarsometatarsal joints and intermetatarsal joints. The inversion and eversion, these are the movements occur in the talocalcaneo-navicular, in this joint, the subtalar joint and the transverse tarsal joint. And you can see the head of the talus, it lies over a shelf-like bony projection of the calcaneus. The calcaneus, excuse me, on its medial aspect, it has a shelf-like bony projection which is called sustentaculum tali, and the head of the talus rests on this sustentaculum tali. That's why its name is sustentaculum tali, because it gives the sustenance of the talar head. Sustentaculum tali, and it forms the talocalcaneal joint. And the calcaneus also, it has a rough bony prominence on its posterior aspect, that is the calcaneal tuberosity. Calcaneus, or the heel bone, it forms the heel and it transmits our body weight during a standing position from the talus, and our body weight is transmitted from the talus to the calcaneus, and through the calcaneus the body weight is transmitted to the ground. And anteriorly our body weight is transmitted into the great toe, and under the base of the great toe and the head of the first metatarsal bone, this area is called the ball of the great toe. So our body weight is transmitted from the tibia to the talus, and anteriorly it is transmitted to the ball of the great toe, and posteriorly it is transmitted through the calcaneus into the ground. And inversion and eversion are the movements in these joints. Inversion means raising the medial border of the foot medially, and eversion means raising the lateral border of the foot laterally. Inversion, this movement is produced by two muscles, tibialis anterior, which is a muscle of the anterior compartment of the leg, and another muscle producing the inversion is tibialis posterior. Tibialis posterior is one of the muscle of the posterior compartment of the leg. Eversion movement is produced by the two muscles, fibularis longus and fibularis brevis. These two muscles are the muscles of the lateral compartment of the leg. They produce the eversion. There are several ligaments which binds the bone of the foot together and helps in maintaining the arches of the foot. The ligaments, important ligaments in the plantar surface of the bones of the foot are the long plantar ligament. There is a short plantar ligament, and there is plantar calcaneo-navicular ligament or spring ligament. The long plantar ligament, it extends from the calcaneal tuberosity, and that goes over the cuboid bone, and then it forms the slips which are attached to the bases of these four metatarsal bone, second, third, fourth and fifth metatarsal bone. And under this long plantar ligament and under the cuboid bone there is a groove, and through this groove the tendon of the fibularis longus muscle. See, this is the tendon of the fibularis longus muscle. This tendon crossing from the lateral side of the foot to the medial side of the foot under this ligament. And this ligament is an important factor maintaining the transverse arch of the foot. So this is the long plantar ligament, and here is the short plantar ligament which connects the calcaneus with the navicular bone, and the plantar calcaneonavicular ligament that connects the calcaneus with the navicular bone, and that is also called spring ligament. The another muscle tendon, see, this is the tibialis posterior tendon, that crossing the bones of the foot from the medial to the lateral side. So tibialis posterior tendon, it is passing and it crossing the medial border of the foot, and fibularis longus tendon, it is passing through the lateral border of the foot, and these two muscle tendon holds all the bones of most of the bones of the sole of the foot and helps in maintaining the arches of the foot. The arches of the foot are formed by the bones and ligaments. Our body weight is transmitted from the tibia to the talus, and from the talus, body weight is transmitted through the calcaneus and through these bones. In between these weight transmitting areas, these are the arches of the foot. These arches of the foot, it acts as a shock absorber and also it helps in maintaining the foot like a springboard and helps in propelling the foot during walking, running, and jumping like a springboard. And these arches, there are two arches of the foot. The longitudinal arch has a medial component and it has a lateral component. So this is the medial longitudinal arch and the lateral longitudinal arch, and connecting the medial and lateral longitudinal arch, there is transverse arch. The medial longitudinal arch is formed by these bones. See, the calcaneus, talus, navicular, medial cuneiform, and the first metatarsal bone. This forms the medial longitudinal arch, which is higher than the lateral longitudinal arch. When we stand on our foot, the lateral longitudinal arch becomes flat. The lateral longitudinal arch is formed by the calcaneus, the cuboid, and the fifth metatarsal bone. And the transverse arch connects the medial and lateral longitudinal arch of the foot, and also it forms a bridge. It connects these two arches, two longitudinal arches, and it forms a bridge in between the medial and lateral longitudinal arch. The transverse arch is formed by the cuboid and the three cuneiform bones. And these arches are maintained by the muscle tendons. Already I mentioned that fibularis longus and the tibialis posterior, and also there are other muscles attached to the bones of the foot. They helps in maintaining the arches of the foot. And also the ligaments which connects the bones of the foot, the long plantar, short plantar, and the plantar calcaneonavicular ligament, all these ligaments helps in maintaining the arches of the foot. The deep fascia of the sole of the foot is thickened and it forms plantar aponeurosis. Like the palmar aponeurosis of the hand, the plantar aponeurosis is strong and thick deep fascia, and it helps also maintaining the arches of the foot. And the plantar aponeurosis is the major factor or the important factor which helps in maintaining the arches of the foot. And arches of the foot are important for propelling of the foot during walking, running, and jumping. That's all for my first section of the leg and foot lecture. I will talk about the muscles of the leg, different compartments of the leg in my second section. Thank you.